Well, welcome everybody. I know folks are trying to get online here, so great to hear and see you all here today. Thank you for joining here on our second Wednesday of the month. Typically we do first Wednesdays, so I'm glad that this is still working for lots of folks. I'm really excited for our speakers today, Nancy Zions and Howard Dangenholtz, who will be presenting about the partnerships that's happening between nursing homes and nursing schools in Pennsylvania. But before I turn things over to there, I do want to just do a little bit of house cleaning. As some of you know, I'm Bianca Frogner. I am a professor here at University of Washington, and I direct the Center for Health Workforce Studies. But more importantly, I'm part of the leadership team for the Award Network, and I'm the chair of the webinar committee. And I want to let folks know that we have our next webinar scheduled for March 5th, where we'll be hearing about pragmatic trials for people living with dementia and their care partners, a presentation by Joan Carpenter. As always, you can find all of our prior webinars online. If you scan that QR code, you can go to the website and see all of our webinars which have been recorded. And we want to hear from you and hear about what topics you want to hear about in these webinars. Also, if you hadn't already heard or haven't already seen the announcements, we do have the Award Network Pilot Award applications that are open and out there, and the deadline is February 28th. So don't forget to apply. We have full awards up to $25,000 and mini awards for $5,000. I want to thank our webinar committee members who have been instrumental in organizing these. Hui-Wen Xu today will be moderating and has organized today's webinar. And this is his last one that he'll be doing as part of the webinar committee because he'll be rolling off, as well as Madeline Sterling, Emily Franzosa, and Jarman Ye. The four of them will be rolling off the webinar committee. And next month, I'll be introducing some of our new webinar committee members. Jin Jun, Megan Gately, and Shirin Villani will be continuing on with us. So again, I appreciate everyone's volunteer efforts in being part of this webinar committee. And then I want to acknowledge our leadership team of the Award Network who helped make everything run. Joanne Spetz is the PI of this award that makes this all happen. And then NIA is our funder, and so I do want to acknowledge them. So with that, I'm going to go ahead and stop sharing my screen and turn things over to Hui-Wen Xu at Emory University, who will be our MC for today. So thank you, Hui-Wen.
Thank you, Bianca. So I'm Hui-Wen. I'm right now a associate professor at the Emory School of Nursing. Today, we are honored to have great speakers, Ms. Nancy Downs and Dr. Howard Dangenholtz. So I know Howard for a long time, so it's great to have Howard join us. And I heard the great things about teaching nursing homes, in Pennsylvania. So let's give them a brief introduction, then we will have their presentation. And I want to hold questions till the end. So if you have any questions, please feel free to type in the chat. At the end, you can also ask to unmute yourself to ask questions. Let's give them a brief introduction. Ms. Nancy Downs is the COO and Chief Program Officer for the Jewish Health Foundation. She is responsible for the grant agenda for the foundation and is the operating arm Pittsburgh Regional Health Initiative, Health Careers Futures, and WHAM Global. Her areas of focus include aging, long-term care, end-of-life, healthcare quality, safety, women's health, and workforce development. She currently leads the Pennsylvania Teaching Nursing Home Collaborative and the statewide long-term care learning network for nursing facilities. She's a co-founder for PA Coalition for Quality and at the End of Life, and she has been active in many of the foundation's initiatives, which I'm not going to go through. For examples, including women's health, working health, and so on. So that's Nancy. She will show her experience with the Teaching Nursing Home Initiative, and we also have Dr. Howard Dangenholtz. Dr. Dangenholtz is a professor of health policy and management and the faculty affiliate of Center for Bioethics and Health Law at the University of Pittsburgh. He was the founding director of the doctoral program in health service research and policy. He is also a health service researcher who focuses on long-term care and aging and organ donation. He is currently the lead for the 7-year evaluation of Commonwealth Pennsylvania Community Health Choice Program. He is a member of Academic Health and a fellow of the Gerontological Society of America. He's a social media editor for the Gerontologist, a social editor for LTSS of Innovation in Aging, and on the editorial board of General Aging and Social Policy. And I have to say, when Harvard was the chair for academic health LTSS interest group, I was a student representative there. So we worked 2 years together. So welcome, Nancy and Howard. The floor is yours.
Thank you so much. It's a pleasure to be here. I'm going to try to share my slides. My team will tell you that's not always possible. Did that happen?
Yes, looks
Yes.
Yeah. Great, because I have something strange up on my screen. So let's see whether or not I can pull this over and get started with it. Okay. So as you know, it's going to be myself and Howard, and we're going to tag team. I'm going to cover the background on the pilot project and an overview of the current phase of the project, but I really want to leave it with how you can get involved as well. We think that this is an effort that the goal is not just Pittsburgh, the goal is not just Pennsylvania, the goal is really taking a model that we think is successful across the country and seeing how it can be used. And then Howard is going to talk about an overview of the evaluation and some high-level findings. I'm going to assume, Chelsea, that my slides are advancing unless you tell me otherwise. So
Yes.
Thank you. So let me tell you how this project got started. So the pilot phase of this project started in 2021, went from 2021 to 2023. So what was going on at that time, or more specifically, what was going on a year before that? And a year before that was the COVID pandemic that was hitting all of the nursing homes horribly. And nursing homes were being blamed for a lot of quality issues and a lot of death. And those of us, I'd been at the foundation 25 years at that time, and we were sitting and watching in horror what's going on at nursing homes and thinking to ourselves, this isn't a result of anything that nursing homes have done, certainly not intentionally. This is a result of decades of neglect of what nursing homes needed in order to be successful to take care of some of the most vulnerable residents of our Commonwealth, let alone the rest of the country. And we thought that that was, to be honest, disgraceful. Together with our colleagues at the John A. Hartford Foundation, the Jewish Healthcare Foundation helped to stand up this pilot project called Revisiting the Teaching Nursing Home. And this was to build on the project that had gone on 40 years ago, where there was an attempt to bring together academic institutions and nursing homes to try to infuse some important knowledge, important opportunities for research and for quality improvement. We wanted to draw on those lessons and make a few changes to the project to infuse new methodologies, new frameworks for quality improvement, and to see whether or not that could actually be done on a small scale. I don't even think at the time we were thinking about the scale up, but we thought we could have lessons learned that could potentially be used by others. And we were building on partnerships that were formed during COVID-19. And some of those partnerships were among funders, many of whom were devastated also by what they were seeing in nursing homes. And some of them were with our government institutions, whether it was Human Services, the Health Department, the Department of Aging, et cetera, within Pennsylvania. So here were the aims of the project. It was obviously to improve resident outcomes and then to enrich the skills of the nursing home staff to promote retention. You will recall that it was a revolving door of staff leaving the industry. They not only were devastated by what had happened, there was moral injury, but there was also huge shortages in workforce. But we also knew that on the other side, in the schools of nursing, there was a need to enhance faculty and student knowledge about what goes on in nursing homes, and perhaps have the faculty help the nursing homes to understand best geriatric practice. But also we knew that nursing students often took a placement in a nursing home as a second or third choice. They all wanted to go to the ICUs and the hospitals and go to something that seemed to be more interesting and sexier. So how could we use this project to enhance the pipeline for schools of nursing? And then, of course, we wanted to track some of the organizational barriers and regulatory barriers to practice, because if we couldn't figure those out, there was going to be no way that we could scale anything going forward. So those were our 4 aims for the project. And we decided to set up 3 regional academic practice partnerships. For those of you who know Pennsylvania, we are pretty well split up geographically, the Western region, the Central region, and the Eastern region. And the idea was to have one school of nursing and one nursing home as a dyad within that region. You will notice since you guys are evaluators and look at numbers, we had 2 nursing homes in the Western Pennsylvania area. That's both because we are located in the Western Pennsylvania area and because we had 2 really good partners that we thought could be instrumental in improving the work of this pilot project. So here were our interventional components. We were doing student and faculty engagement, just-in-time learning, advanced practice nurse engagement with the nursing homes, and then introducing age-friendly health systems for nursing homes. And for those of you who are not familiar with age-friendly health systems, it's a 4Ms framework, and it really is very patient or resident focused in this case. And it is not individual strategies. They are taken as a package. It is a framework, and it focuses on mentation, mobility, and medication as 3 Ms, but then wrapped around that is the 4th M of what matters. It starts with what matters to the resident and how do we organize all of the care for that resident around what matters to them. When we started this initiative, I'll be very honest with you, the 4Ms framework developed by the Institute for Healthcare Improvement, together with the Catholic Health Association, funded by the John A. Hartford Foundation, didn't have separate nursing home strategies, communities, action communities going forward. And it was very frustrating, I will tell you, for our staff to get started and have all the examples, be the examples of hospitals and all of the professionals they were talking about, be the doctors in the hospital, that didn't seem to really reflect the environment in the nursing home setting. And so over the first few months of the project, while it was getting off the ground, our 3 initial pilot project sites had to live through that frustration, but really helped to shape the creation of a guide for nursing home implementation for the 4Ms, which has been proven to be very helpful as we go forward. So there was a lot of just-in-time learning that went on. We used both a national and statewide advisory to help us, but we also used our academic practice partners to help give just-in-time learning in areas of how to form academic practice partnerships. When I went to a meeting of the Pennsylvania Directors of Nursing Association, and I asked a question that I didn't know the answer to, I said, how many of you have relationships between your School of Nursing and your nursing home? And all the hands went up, and that wasn't what I was expecting. And then I said, how many of you have satisfactory relationships between your nursing home and your School of Nursing? And a lot of the hands went down. And I said, aha, that's where we really need to work. What does an academic practice partnership really look like in this setting? How do we introduce age-friendly health systems? And how do we really focus on what was termed the care force and the regulations that could possibly either advance or impede the work that we were looking to do? I'm pleased to say that over the course of this work, the first ever textbook for frontline workers in long-term care nursing homes was created, and 40 of the authors of various sections of this book come from this project. So it is available if anyone is looking for a text that they can use. We're happy to have that. And of course, dementia plays a very important part in the work that we do. In this setting in the nursing home, it's of course almost ubiquitous for residents. It is certainly a factor that needs to be considered for every single one of the residents. So how do we infuse and educate the students coming in about dementia? That was something that was really important to us during rotations or in prep for them to go in for their rotations within nursing homes. So the School of Nursing, there was some deep dive work that needed to go on relative to dementia. And then in the nursing homes, several of our nursing homes use MOCA, and some of the homes are implementing, while they implement the mentation part of the 4Ms, have been very focused on what meets the federal guidelines and state guidelines of trying to focus on non-pharmacological interventions, particularly for persons with dementia. So here's where we got to at the end of phase 1. We had 677 nursing home staff who were trained in the 4Ms, and 591 residents who received age-friendly care, and 510 nursing students who were engaged in the 4Ms. And for a pilot project with 3 sites, that was pretty exciting to all of us. Certainly very exciting to the John A. Hartford Foundation, who after year 1 of a 2-year pilot said, let's do this on a big scale. Let's take this all across Pennsylvania. So here were some of our outputs of the nurses that were involved before they got started with this project, year 1, year 2, and then overall 510. And we were very excited with that growth. And here were the nursing homes that were also the nursing faculty, I'm sorry, that were participating. It was almost a little secret that there weren't very many people who were involved as faculty in this sort of work in their schools of nursing. And then over time, dare I say, we helped to make it cool to be involved in geriatrics within their academic setting and to be involved with nursing homes. To let people know that they're not the only one in their school of nursing that has an interest in this work, and that seemed to breed some sort of community within the schools of nursing, and that was very exciting to us as well. So those are some of the outcomes from the pilot project. Oops. And some of the lessons that we learned was that age-friendly health systems seem to work as a unifying principle, and that it was really important to orient faculty for the nursing home setting. They really needed to understand how it was different than the hospital setting, and they really needed to be champions and mentors for the students. If they were the ones who were glum when they said you got a nursing home placement, then the student could be glum and uninterested in the work. But if we had champions, that could really make a difference. And then planning for clinical placement. When we would talk to nursing schools and nursing homes and find out what disappointed them in their partnership with schools of nursing, they were always, of course, very excited to have an opportunity to have students in there, but they weren't so excited to have a student who was in their first semester, knew nothing about geriatrics, knew nothing about the setting that they were coming into. So what was the advanced prep? Knew nothing about dementia, knew nothing about the fact that that would be pervasive in a nursing home potentially, and how could they develop those skills and strategies to work with persons living with dementia, and how different that was from what they might have been thinking for other clinical or seeing in other clinical rotations. So those were some of the lessons that we took with us into a second year pilot. But this is really on this screen what it's all about for me are these pictures. The top one, the top right-hand corner to me is just about my favorite image of this entire project. It's this idea that you have those two students that you can tell it's still in the height of COVID, because COVID in nursing homes is really not even still over, but this picture's probably about a year or 18 months old. But there they are with their face shields when we thought that was important, and their masks, and they are probably getting the best one-on-one education they're ever going to get in their life, one-on-one with a resident in a nursing home doing a what matters conversation. And if you can get a student to do that at the beginning, you hopefully have converted them into a lifelong lover of the geriatric population and a desire to do right by them, whether it's working in a nursing home or not. But I will tell you that of the 100 or so more people that are involved in this initiative now, the number of them that proudly say they started their careers as a CNA or as a volunteer in a nursing home is off the charts. For people who were engaged in that work early on in their life, it seems to be, and I'm not a researcher, it seems to be some way to connect them to this work on an ongoing basis. But the smiles in here just mean the world to me to see the youngest of the young students together with some of our oldest residents across Pennsylvania. It's very heartening to see those generations coming together. So as I said, Johnny Hartford Foundation, very happy with this work, and turned around and said, okay, let's do this on steroids. Why don't we do all of Pennsylvania? Why don't we do every single nursing home and every single school of nursing in Pennsylvania? And we stupidly said, sure, let's do that. How difficult can that possibly be? So we set up on for a phase 2, which is 3 years long, not 2 years long. And this, we knew we would need broader stakeholders from the private public sectors as well as the other schools. The goal obviously is about resident care, but the focus is on maximizing the engagement of the key partners across the state and evaluating this. Evaluation became a much greater part of phase 2. In phase 1, it was more of a proof of concept, but in phase 2, we're deeper diving in evaluation, thanks to Dr. Dagenholtz, who was with us in phase 1 as well. So here are some of our key partners. In addition to all 3 of the nursing schools and the nursing home, the 4 nursing home partners from phase 1, we went wholesale. That was retail. So we went wholesale to the Pennsylvania Director of Nursing Association. We went to PHENSA, which is the Higher Education Nursing Schools Association. And then we joined with the Moving Forward Coalition, which was the national group formed out of the NASM report on improving quality in nursing homes. And we got involved with them to see what were the policy pieces we needed to pick up here, whether it was ownership, whether it was making sure we could get appropriate funding to train and recruit and retain the front line in nursing homes and to make sure that we could remove barriers for people becoming nurses in this setting. And then we worked with Pulp Med, that's their new name, was leading and for them to help us with their More of a Good Thing initiative, which is really focused on how do you use the 4 M's to focus on the leadership within nursing homes. Here's the framework. Academic practice partnership is at the core, age-friendly health system is at the core, and together we end up with a revisiting the teaching nursing home framework. Those two things coming together. Not just sufficient for you to go off on your own and get your age-friendly health system designation for a nursing home, not just sufficient for you to infuse things in your school of nursing, but it's where those two things come together that we really think is the sweet spot for this, this project in phase 2. We've developed a ton of resources through the Jewish Healthcare Foundation. There's one-on-one coaching that goes on in Pennsylvania. Our goal is to do this in Pennsylvania as a deep dive, but to also have 5 or 6 or 8 or 9 states watching us as we do this and try to figure out how they could implement it within their states as well. So we have coaching going on in Pennsylvania. We have office hours that provide peer-to-peer learning. We have quarterly learning sessions that go on in terms of webinars. We have a ton of resources that have been developed, from videos to guides to tools. We have a member map. So if you're a nursing home looking for a school of nursing, or you're a school of nursing looking for a nursing home, you can look at the map and see what's out there and see who you might want to partner with. It's not as easy as just geographically matching people up. Sometimes you have an organization that has 10 nursing homes and they want all of them to associate with the same school of nursing. So whether they're geographically dispersed or not, we can figure out how to make those partnerships work. And then, of course, we have, and Howard will talk about, the evaluation surveys to measure the impact of this work on the front line, on the nursing homes, on the schools of nursing, et cetera. So we are spreading age-friendly health systems by using any wholesale mechanism that we can find. So one-on-one getting nursing homes to do age-friendly health systems was taking a long time. It's hard to get people to do that heavy lift. We have another tool in our toolbox at the Jewish Healthcare Foundation, and that is we run the statewide long-term care learning network that trains is open to all 600 nursing homes in Pennsylvania on a regular basis for free, for them to come and get education from 2 to 3 on Thursday afternoons. So it's not just free education. They are required to participate because it's part of the quality incentive program by the Department of Human Services. They're not required to be there every Thursday, but please don't tell them that, because I tell them they're welcome there every Thursday, and I hope they all show up. But what we decided to do for this quarter is, while we, over the past 2 years, have introduced the concept of age-friendly health system and introduced the concept of the collaborative, from January to March of this year, we have been using 9 of those sessions on Thursdays to introduce each of the 4 M's individually, and then a case study on each of the 4 M's or the implementation successfully within those nursing homes. So the nursing homes can see what their colleagues have done. They can see what the lift is. And if they follow through with the homework that we give them every week, which is minor from the Institute for Healthcare Improvement, they can come out of this at the end of March with level 1 designation for age-friendly health system. So instead of them doing it themselves and trying to figure out how to go through the books and the tools, if they come along on this journey with us, they can get all the way there together with us. So we are very excited about it. These webinars are open and they're free. If any one of you would like to attend them, you just need to get a hold of us. You can register, you can come to one of them, you can come to multiple ones, but it is an excellent way. It's an excellent way for us to reach this audience. And they trust us now. We have been doing this network now. We started it literally in March of 2020 at the beginning of COVID. We used it at the time for infection control, and since then it has clearly grown. But if any of you are interested, you are welcome to come to the weekly webinars. And now LTC Rise, which is a program of our Department of Health, has also accepted as a goal for themselves for this year to get, I think it's 20 or 25% of the nursing homes in the Commonwealth of Pennsylvania also involved in age-friendly health systems. So we have another partner on the ground providing some coaching support. So let me tell you where we are so far before I turn it over to Howard. Over the past 18 months, 47 nursing homes have filled out a Join It form. But we know just in this quarter already, and we're only halfway through the quarter, we've had an additional 583 people attend the initial webinars, representing 149 distinct nursing homes. So we have 149 nursing homes that are, in addition to these 47, maybe sometimes including a few of these, that are actively involved in this age-friendly health system journey with us. 22 schools of nursing in Pennsylvania. What's the denominator? The denominator is 30. That's a lot of nursing schools that we have been able to reach across Pennsylvania. So we're excited at the potential to reach all or most of them. And we've expanded in phase 2 to also include community colleges, because we know how important it is for so many people in the nursing home space who get their start in community colleges. And we have, as I said, other organizations across Pennsylvania and across the country participating, watching, joining, stealing from us, and we are grateful to have them steal from us. They have all joined the Pennsylvania Long-Term Care Learning Collaborative, and we are hoping that you will join it as well. So how do you get involved? So you can visit our website, which is PATNHC for Pennsylvania Teaching Nursing Home Collaborative.org. Go to Get Started, fill out a Join It form, which is so simple, and then you'll get information. You'll get invited to all the things that we do. You can also email us. My email address is there. We would love to hear from you. We'd love to hear how this sits with you. If there's any other initiatives or resources you think that could be helpful to this initiative, we would love to know about it. And we would love to have people come along with us on this journey. We think it's really important. The nursing homes went through a tremendous amount over the past 5 years. The residents of nursing homes went through a tremendous amount. Their families went through a tremendous amount. We owe it to them to develop frameworks and quality strategies that will work for them. And that's what the focus of this initiative is. So I'm going to stop there. I think I used my time wisely. Chelsea and Howard will tell me otherwise. I'm going to stop sharing and turn it over to Howard and the rest of the group.
And give me like a second to get my desktop organized, and I'm going to launch this, and then I'm going to share that. Okay, can you all see my screen?
Yes.
Excellent. So let me just do this. I'm going to minimize that, and I can't see the chat or anything. So if any questions come through or anybody raises their hand, I guess I'll have to rely on you, Huiwen. So first, I want to thank Huiwen and for inviting me to be a part of this series of webinars. As he said, I really enjoyed working with him on the Academy Health LTSS interest group, and I would encourage anybody who is interested in researching in this area and interested especially on the policy angle to join Academy Health and engage in that interest group, because it's a really great community. The second thing I want to say is I want to thank Nancy for just really graciously touching on our work and setting the stage for how we have been collaborating on this project, and just point out to the audience that when Nancy called me up and said, I have a project, and I said yes before I even heard about it. So so it's just been it's always rewarding to work with the Jewish Healthcare Foundation, and it is this project is really no difference. So I'm going to jump into it, and I'm also going to tag off to Kenna. So Huiwen, maybe you can make her also a panelist so that she can grab the microphone, although I don't think she'll need to share her screen because I have the slides. So we've been conducting see if I can. So let me give you a quick overview. So I'm going to give you an overview of our general approach to evaluating this the project that Nancy was describing, and then give you a deep dive into the different components of the evaluation and some of our recent findings, focusing on the most recent year, which would be 2020 calendar year 2024, which is the first full year of the phase 2 of the project. So So first off, and I think you caught this from Nancy's presentation, that there are a number of operational measures, and Jewish Healthcare is tracking that. How many nursing homes have been reached? How many have been implementing the age-friendly 4Ms? How many have partnered? How many schools of nursing are cooperating and participating and have partnerships with nursing homes in the state? And so that's kind of what you might think of as like the formative research component. Our team, the evaluation team, we're focused on the outcomes, and that includes such things as the faculty members, the School of Nursing faculty members' sense of what's going on in this project, like how well prepared they are, how well prepared their students are for really implementing the 4Ms or learning about the 4Ms and implementing them in a nursing home with older adults. We're also trying to figure out how students' preferences for working in nursing homes change. As Nancy said, there's a big, that's one aspect of the impact that the program hopes to have on the workforce. And then we're also working on nursing home staff satisfaction because all of the quality improvement activities that the nursing homes are undertaking should have an anticipated effect on staffing outcomes. And then also, and the last and most difficult is really examining the quality of care at the resident for nursing home residents. We put together this broad framework to kind of put all of this together and articulate what's going on in three different tracks. So from the nursing home perspective, there's the implementation of the 4Ms, and then on the first row, and there's these the outcomes. I'm going to grab my laser pointer in terms of clinical outcomes and also staffing outcomes and staff satisfaction. But then we're also studying on this boundary between the nursing homes and the School of Nursing faculty, collaboration and consultation. So that's the connections that are being forged between the schools of nursing and the nursing homes themselves. And there we're using more qualitative methods to address that. On the track related to the School of Nursing faculty, this has to do with the individual faculty members' real preparation for implementing the 4Ms in their classroom. But also, you can see on the boundary between the School of Nursing faculty and their students, there's this question of competencies and if they're teaching to these 4M competencies in the classroom and then orienting those clinical field experiences when the students go into the nursing homes around the 4Ms, then we should see growth in terms of students' competencies related to the 4M areas. And importantly, that can be measured both from the perspective of the student and from the perspective of their faculty member. And I think we'll have a little bit of data on this as well. From the student's perspective, we're capturing their experience in the field when they go into the nursing homes, and also as a longer term outcome, is this really having an impact on their career preferences? So digging into it, I'm going to break this up into two big buckets, the nursing home staff satisfaction and the School of Nursing and faculty surveys. And then component two, this is still a little bit down the road in terms of clinical outcomes and how we're going to be measuring that. So component one. So first, we've been conducting annual staff satisfaction surveys with the participating nursing homes. This started in 2022, and then follow-up data has been collected in each consecutive year, 2023 and 2024. The instrument that we're using is the CMS Staff Satisfaction Survey. This is available free with no license fees. And we built it into a Qualtrics survey. It measures 5 major domains: overall job satisfaction, teamwork and collaboration, scheduling and staffing, training, and management and leadership. And one of the things that we've done, I don't know if we'll show it per se, but we've also built this into a portal that each nursing home champion can log on to and actually see their results in real time. And then we're about to release a new version of that report that'll have built-in automatic benchmarking. The surveys are distributed digitally and manually, so we basically put up a poster in the nursing home with a QR code, and staff can scan that, complete it on their phone, and then because compliance with that is shall we say, mixed, we also will usually go out and distribute some paper surveys as well. So, shifting to talking about the students and how we're addressing this with the students, one of the things that that's really been important in this project is that it has been a developing and evolving program over the last few years. So one of the things that we've done as the evaluator is keep up with the innovations that the schools of nursing are undertaking. For example, as Nancy mentioned, there's this textbook that was developed. And then there's been all this growth in terms of the number of faculty that are participating and enthusiasm from the schools of nursing. So one of the things that we recognized that was that when we started, there was kind of this like notion that we were evaluating the outcomes for undergraduate nursing students, and that it was kind of an undifferentiated category of learners. But what we realize is that there's actually 4 different kinds of learners. There's undergraduate nursing students, so that's like your BSN student, who's in a general nursing course. Then there are some undergraduate nursing students that are in an aging course, like nursing care for older adults. And then there are graduate nursing students, like advanced practitioners or MSN students who are in a general course. And then there are graduate level nursing students who are in a gerontological specific course, for example. And those tend to be like an independent study or some kind of tailored experience. So what we did was we took the 4M domains that Nancy presented earlier, and then associated with that were a set of competencies and skill areas around each domain. So there's about 8 competency areas, and we crosswalked that with the AACN, which is the American Association of Colleges of Nursing, their competency model for nursing education. And then we developed statements for each competency area for each of these 4 different types of learners. So then what we do is we built a survey that students can complete at the beginning of the semester and at the end of the semester. And that allows us to track students' competency level, basically before they've been exposed to the content, before they've had any clinical experiences, and also the faculty are also rating each student. That's a little bit more of a burden, and that's a piece that we're still analyzing those data. Just to give you an example what this looks like, this is too small to read, but maybe we can put into the chat the link to the AACN website, Kenna, if that's something that we have available. So this is just an example of how that mapping worked. So interview a resident. So as you're probably, if you're paying attention at home, this has to do with the what matters domain. So in order to understand what's important to an individual nursing home resident, you have to talk to them. Now that overlaps with several of the AACN domains, and then we articulated it in terms of a competency statement that summarizes what a student should be able to do if they have learned this skill. Just going to give you a brief overview of the clinical outcomes here. So, I'm sorry. I think that was a little bit out of place. This is the component on the nursing faculty surveys. Again, we do this at the beginning and the end of the semester. The start of the semester is used actually to capture general course info, and we need that to make sure that we are sending the course instructors the right information for their students, and that we have some basic information about each class. But then it's the end of the semester, which is really the key, where we capture faculty members' experience with the program and also their assessments of their students. Now, one of the things that we've done is we have automated this. So as Nancy pointed out on the on the website, where a school of nursing can join the program, they can actually go through all the links to these surveys are available on that website. Once they register, they will get a survey sent via email, and then the start of the semester survey, they'll indicate, what kind of course they're teaching. Is it that general undergraduate or Gero undergraduate? And the survey, which is distributed through Qualtrics, will actually give them a file that they can download, which has the student surveys in a package that can be uploaded into the Canvas courseware software. So what that does is it essentially automates, from our perspective, and scales this whole project so that a school of nursing, a faculty member from a school of nursing, can join this, get the material that they need to implement those student surveys, those student competency surveys that I was talking about, directly without having to go look for that information. And then the end of semester survey for the faculty members actually has a section where they can upload the results from that Canvas survey. Okay, so just talking a little bit about how we're going to be approaching the clinical outcomes. This is still very much in the TBD section, but our plan is to use a combination of both EMR data and MDS data to measure each of the 4Ms. So I have just some notes on each one of these with regard to mobility. So from the MDS, as people on this group probably familiar, from the MDS, you can capture just broad rates of falls and injurious falls. But the question in terms of the deeper question around mobility is whether around really doing quality improvement around mobility is whether an individual has a mobility plan and what's being done on that plan to enhance their mobility. So without getting into too much the nitty-gritty on it, people who've done research in the space and providers, I'm sure, are aware that that information is really going to be in the electronic medical record and not in the MDS. So we're working with one of the participating nursing facilities to gain access to their EMR data, which will allow us to construct those measures. So in the interest of time, I'm going to move through this and just touch briefly on what matters. This is a domain area that is, as Nancy said, very critical to the overall success of the program and critical to understanding the 4Ms. But it's not something that's traditionally captured in the electronic medical record or in the MDS. So one of the things that we've been doing is doing interviews and site visits with nursing facilities to capture how this is being done. And then in a couple of the participating facilities, they are building what matters information into their care plans, and in one place developed a what matters templated note. So we're working on methods to extract that from the electronic medical record. So going to give some findings. So here are staff satisfaction scores for the past 3 years of the program in terms of overall job satisfaction. You can see it's been basically relatively stable over time, with maybe a slight decline and a slight increase. And then you can also see what looks like a slight decline in terms of team building and also the management and leadership. And that's not exactly the direction that we were hypothesizing. However, the thing to bear in mind is that there's some changes in which nursing homes are participating. So in these data, we have, I should have said earlier, we have 4 of the original nursing facilities from phase 1 are fully participating in the nursing home in the evaluation, and then 2 nursing homes from phase 2 are participating in the evaluation. So we have a little bit of differences in which nursing homes are participating over time in these data. Kenna, can you jump on the microphone and talk through this slide real quick?
Yeah. So what you're looking at are the student expectations from the start of term student surveys, where they were asked to respond to what they expected from their visit to the nursing home. So in total, we collected about 208 responses and divided them into 6 major groupings. You can see that the majority of expectations, about 52%, fell into the understanding the nursing home environment, which was defined as the expectation of learning how nursing homes operate, including routines, care approaches, and how they differ from hospital settings. You can go to the next slide. And so what you're looking at here are from the surveys that we took at the end of the semester, where students were asked what the most important thing they did in the nursing home was. We collected 211 responses and again organized them into 6 major groups. The majority of takeaways fell into 2 categories, but I'll focus on the highest. The highest proportion of responses, about 41%, belong to the importance of emotional connection and companionship category, which we described as the importance of providing emotional support, meaningful conversations, and connections, and improving the residents' quality of life and providing holistic care. Next slide, please. And so here we've highlighted an example of one student's takeaway that belonged to the personal and professional growth category, which was the 3rd most common takeaway. Here you can see the student explaining how this experience and their involvement within the initiative allowed them to adapt and refine their communication skills to fit the needs of residents with dementia, and also the value that they saw in this practice and experience. Next slide, yeah.
Thanks, Kenna.
Mm-hmm.
So in the student surveys, starting in the 2024 with the second phase of the project, we added a scale about internalized ageism. And what we wanted to see is if the experience of going to a nursing home and working with older adults would have an impact on people's attitudes towards working with older adults. Now, you can see we just have this for this is for the start and end of the semester. And this is just at the, I think this is just the beginning of the term. And you can see there's an interesting pattern going on here where we stratified it by whether or not students had prior experience with older adults or working in a long-term care setting. And as you would kind of expect, the ones who had work experience, they had less internalized ageism than people who had no experience, and the people who volunteered with older adults or in a nursing home were somewhere in the middle. Now, interestingly, we looked at whether these attitudes changed over time, and the finding here was that the people who had no prior experience, they started out with the highest level of ageism, but at the end of the semester, they were actually at the lowest level of internalized ageism. The other 2 groups basically had no change, and you could see there's like a very small increase, but if you look at it numerically, it's like from a 1.6 to a 1.9, so that's not statistically significant. So the real interesting finding here is that we see this decrease in ageism specifically for the people who had no prior experience. That's a really positive finding here. All right, so we did a number of site visits, and for each site visit, we wanted to understand how they are using or implementing the 4 M's. This occurred during the second half of 2024, and we also conducted a group interview with staff from all of the teams, and we let the nursing homes and the site champions identify who from their facility was most relevant to this project. So we didn't tell them specifically who needed to be in the room. We let them tell us who was involved with the project. Okay, so, I'm sorry, I went too fast. So I'll just quickly summarize a couple of the observations that we had from those from the site visits, and then we'll hopefully turn it open to questions. So first, from broad observation, was that by creating a common language that is mobility, mentation, medication, and what matters, that the 4Ms have the potential to better integrate nursing homes within the larger healthcare system. This was based on a couple observations that the nursing home champions in their when they were accepting transfers from hospital were starting to see medical notes that were templated with the 4Ms. So this was a really positive finding. We saw that nursing homes were starting to use electronic documentation of the 4Ms, and that enhances their internal communication and strengthens the 4Ms and strengthens that implementation. This was particularly relevant around the what matters domain, where they would document what matters and to the resident, and oftentimes that had to do with a mobility-based goal, and then that transferred over into a mobility note that indicated some specific issues for that individual, often implemented through restorative nursing around maintaining function or improving function. And then staff at the nursing homes, we found that they are really motivated to engage with the universities and the students, and that this was cutting across the different departments of the nursing home, not just the nursing department, but also social work and activities and all of the other components of the facility. And we also saw that a couple of the nursing facilities were starting to partner with nursing programs outside of this particular program. So there's a little bit of a positive spillover effect going on as well. And from the perspective of talking to the nursing homes, it's changed what they do when the student nurses come into the building. And this is really the most important finding that I want to share, which is historically, and Nancy showed that photograph of a student talking to an older adults. Historically, the nursing students would show up, and they would show up in a big group, and the nursing home staff would be a little bit overwhelmed, and they would assign the student nurses to shadow the aides. And while that's maybe good for an hour or two, the problem that arose was that student nurses who are studying for a bachelor's of nursing are not studying to be a nursing assistant. So they're being asked to do work that's not really what they're in their career path. So what this program has done is really, really engaged the leadership at the participating nursing homes in rethinking what student nurses are going to be doing during the day when they're actually there. And that has emerged. Some of the things that have emerged from that are not just sending them out onto the floor, but actually spending some time talking to them about what goes on in the nursing home from the perspective of each different department, and then shadowing the nurses and doing nursing tasks, not just shadowing aides and doing ADL tasks. So let me stop there and see if there are any comments or questions. And I'm not sure how to facilitate that, Liwen.
Great. Thank you, Howard and Nancy. I think this is a fantastic overview of the program and also the evaluation. So I have a kind of a big picture question, Nancy and Howard. So this program is great, and you kind of showed it works, in Pennsylvania, but it's funded by foundations. So what's your view, or what's your plan for expanding or sustaining the program in Pennsylvania or beyond?
So one part of this is building value. So if the nursing homes and schools of nursing that are joining us in phase 2, they're not being paid to join. So the phase 1 partners were paid to join and be part of the pilot project, but all the other nursing homes that are joining it. They're not getting paid, but they are getting a vast array of resources that they can use. So that in and of itself is a sustainability mechanism. All of the educational materials, all of the videos, all of the webinars, they're all going to be available in free space to anyone, Pennsylvania and elsewhere. So that's one piece of it. And the other has been really working very hard with the public sector, particularly Department of Human Services and Department of Health, to focus on those policy issues like salary, paid training for new people, et cetera, getting those mechanisms into the governor's budget and elsewhere, and getting this workforce issue elevated to the top of people's to-do list makes this work more sustainable.
I'll add, and Nancy, you probably haven't, this is probably news, but as part of the governor's budget address, workforce has been identified as a priority area. And I actually have a separate project with the Pennsylvania Department on Aging to work on an update to their blueprint for the long-term services and sports workforce. So the nursing workforce is a key, really critical component of the overall LTSS workforce. So yeah, that's definitely part of it.
Great. I saw another question from Laura. She's interested in about graduate nursing experience, conducting research and involving students for the DNP or NP students in nursing homes.
Yeah, this has come up. There's been some independent study projects where advanced nursing students have undertaken individual projects, and a lot of these have been oriented towards the What Matters domain, where they will do What Matters interviews with all new admissions to the nursing facility, and they'll document that and then pass that along to the to the clinical team and to the director of social work and activities, to implement that or make it part of the chart as appropriate. And that's been, that's a win-win, because it is an activity that I think has a relatively easy learning curve for students, but also it's a force multiplier for the nursing facilities, because that's not a task that is really part of the job description, traditionally part of the reimbursement model for nursing home staff. So it is a way that nursing students are gaining experience and also supporting the facility. Nancy, do you have another QI project example? Okay. So
no, only that we've allowed some of the nursing homes to hire interns that have been paid for out of this project for them to get that sort of experience and encourage others. And by them writing papers about their experiences, it's a mechanism for dissemination.
Yeah,
So
and
we do have an academic, we do have an academic publications group that is working very closely to try to make sure that we can get whatever stories are coming out of this and whatever data into the academic press.
And each of the schools of nursing has, taken the lead with their own students, especially those advanced students. They who are, have a research requirement, for example. So this is an opportunity for the School of Nursing faculty to engage those advanced students at a higher level.
This is just fantastic. I feel this is such an important and missed bridge in the past. The nursing schools, they're doing their own thing, nursing homes operate on their own. Finally, we have a bridge, to connect them, make a channel for the student, for the information, knowledge, everything. I want to be mindful of time. Bianca or anyone else, you have the last minute question? We can make
I just wanted to thank our speakers. This is so fantastic. I learned so much myself, and hope that maybe we can find ways to disseminate this broadly, even bring it over here to the West Coast. I'll have to talk to my colleagues here at the School of Nursing about it. So.
I'm at School of Nursing in Emory, so I will talk to my deans to see how we can, expand that in Georgia.
And everything we're doing now is in the Zoom realm, right? We're not meeting in person. So somebody from a different state that wants to engage with this work now, side by side with us, and just watch it happen or participate, come on along.
So Bianca, there's a little synergy to share with you, which is that with Jarman, who is part of your group and also rotating off of this committee, but she's also very involved with the Age-Friendly Health System Research Collaborative, and I'm on the advisory panel for that. And I'll actually be in San Francisco for that group this spring. So we can maybe have a sidebar and see if there's an opportunity we can. I'd be happy to come and build in some time with the School of Nursing if that would be valuable. Adjacent to that meeting.
Sounds like connections certainly need to be made. Well, thank you so much, everybody, for presenting today. And Hui Wen, thank you so much for all your work coordinating everybody. But Nancy, Howard, and Kenna, I really enjoyed this conversation, and we'll certainly
Chelsea,
make sure to share it.
Chelsea from our staff, I couldn't have done it
And
without
Chelsea, too.
And
So
thank
my
you, Chelsea.
silent
Yes,
partner.
thank you, Chelsea. Thank you so much for helping to coordinate so much in the background. Well,
Take
have
care.
a wonderful day, everybody.
Thank
Thank
you.
you.
Bye. Take care.
Bye-bye.